Hello, it's nice to have you back to class. This is AAP 301, the fall semester of the Applied Anatomy and Physiology course. And of course, my name is Dr. Delcina Bean Burrows, and this is lecture number 2. And of course, this is chapter 2 of the Archer and Nelson textbook. We are going to be looking at the body and its terminology in this week's lecture. So the learning objectives for today's lecture are, upon completion of this chapter, the student will be able to describe and demonstrate the anatomic position. The student will also be able to name and describe the 3 planes of body movement. They will also be able to demonstrate the use of proper terms for describing location and movement. They will be able to list and define common medical prefixes, suffixes, and/or roots. They will use appropriate terminology to name and locate the primary body cavities and regions. They will also be able to list and define several common pathology terms, and they will also be able to list 4 classes of disease and provide examples of each. Learning terminology is an integral part of proficiency. The study of the human body involves scientific names for structures, locations, and physiologic mechanisms. For manual therapists, medical terminology allows clear communication. Medical terminology also is needed for understanding pathologies and scientific research. We begin our orientation to the body by looking at the anatomical position. The anatomical position is the standard body reference position used to navigate anatomical terminology. The anatomical position is the body standing with arms at the side, feet shoulder width apart, and the face, feet, and palms facing forward. It is the basis for all anatomical terminology. All location, position, and movement terms are based on the assumption that the body is in this position. When we consider the orientation of the human body, we have to consider what is referred to as body planes. Body planes are used to describe the location and position of body structures. The sagittal plane vertically divides the body or part of the body into right and left. The frontal or coronal plane vertically divides the body or part of the body into front and back. Then we have what's referred to as the transverse or horizontal plane. It horizontally divides the body or part of the body into a top and a bottom. The diagram here illustrates how the body planes divides the body into specific sections. A demonstrates the frontal plane, B demonstrates the transverse or cross-sectional plane, and C demonstrates the sagittal plane. We also use directional terms when we consider the orientation of the human body. Directional terms clearly communicate the position of one body part in relation to another. For example, the scar is superior and lateral to the left nostril. The directional terms are easier to understand and remember in pairs of contrasting terms. Now let's consider the directional terms of proximal and distal as well as lateral and medial. Beginning with proximal and distal, proximal refers to the closest point of attachment to either the shoulder or the hip joint. Distal refers to the farthest point away from those attachments. When it comes to lateral and medial, consider that there is a line that goes straight through the human body from the top, from the nose to the umbilicus, all the way to the bottom. And this is referred to as the midline. Structures that are closest to the midline are referred to as being medial, while structures that are further away from the midline are referred to as being more lateral. Now let's consider 4 more directional terms. These terms being superior, also referred to as cephalic, anterior, also referred to as ventral, inferior, also referred to as caudal, and posterior, which is also referred to as dorsal. When we describe a body structure as being in the superior or cephalic region, we are referring to structures or positions that are closer to the head. When we consider the inferior or caudal direction of the body or body part, we're referring to structures or positions of the body that are closer to the feet. Now, when it comes to the surfaces of the body, we usually refer to either anterior, which is ventral, or posterior, which is dorsal. Anterior is describing any part or feature of the body that is on the side of the face, or the same side as the face, or the stomach, if you will. While the posterior or dorsal is used to describe those surfaces, those body structures, or anything like that that is located in the back of the body, where you can only see the back side of the person. So of course we have here the posterior view, which we were referring to just previously here, and it is also referred to as the dorsal view. So those terms are used interchangeably: posterior view, dorsal view. They're the same thing. And of course we have this nice little key directional terms chart here, which gives you the definition. And of course this is in your textbook. As we said earlier, anterior or ventral refers to the front. Posterior or dorsal refers to the back. Lateral refers to farther away from the midline. Medial refers to closer to the midline. Superior or cephalad refers to above or closer to the head. And inferior or caudal refers to anything below or closer to the feet. Proximal refers to closer to the attachment point with respect to the extremities. Distal, also referring to the extremities, anything that is farthest from the attachment point. Superficial is closer to the surface of the body. Deep is farthest from the surface. Contralateral is the opposite side of the median, and ipsilateral is on the same side of the median. Some more key concepts to consider in our orientation to the body. Movement terminology describes how structures move in general and in relation to other parts. Movements on the frontal plane move toward, which is adduction, or away from, which is abduction, the midline. Movements on the transverse plane move toward horizontal adduction or away from horizontal abduction midline. And movements on the sagittal plane move toward the front, such as flexion, or the back, such as extension. And for those of you who did not have the induction prep course, or this is your first introduction to anatomy, don't worry, these terms will become second nature in no time flat. This diagram illustrates abduction and adduction. You will sometimes hear me use the term abduction and adduction just so that you don't get confused as to which term I'm referring to. So abduction is when the body or the extremity moves away from the body or away from the midline, as we see here, abduction. And adduction is when the extremity moves back towards the midline of the body. And abduction and adduction occur within the frontal plane. The reason being is that if the arm were to continue in its present course of moving through the body, it would divide the body into front and back parts. So this is why we say it occurs in the frontal plane. We also have what is referred to as horizontal abduction and horizontal adduction. Horizontal abduction and adduction occur in the transverse plane because if the movement were to continue, it would divide the body into top and bottom parts. Horizontal abduction is movement that occurs again away from the midline of the body, while horizontal adduction is movement that occurs towards the midline of the body. Flexion and extension are movements that occur within the sagittal plane. These movements divide the body into right and left halves. When we consider rotation and circumduction, rotation can occur in any plane because there is a single axis point. When it comes to circumduction, circumduction in a complete circle moves through all of the planes. So rotation and circumduction are somewhat, special categories because it's not just one plane that we're dealing with. So it becomes a little easier to understand all of the planes of movement when we consider the general 3 planes of motion. And as I mentioned earlier, this will all become a lot clearer when we have our practical labs. And for those of you who are doing this online, it'll still become clearer to you when we start to do analyze more of the movements in terms of what's actually occurring. Now, some other reasons as to why we need to have an understanding of the common anatomical terminology that we will use as natural health and osteopathic practitioners is that it gives us an understanding of the terms that are important to study for the human body. Anatomical terminology describes the location and relative position of structures more precisely. And as manual therapists, we will use medical language to communicate effectively with other healthcare persons within the healthcare community or arena. And when we consider the fact that, we as natural health practitioners are sometimes not viewed as having the same scientific basis of our study as compared to conventional healthcare practitioners, this will help to solidify that we are using the same anatomical scientific terminology that they use, and this will continue to help us to gain credibility when it comes to advancing our practice and our fields. Now, when it comes to prefixes, suffixes, and word roots, you should know that many anatomical and physiological terms are formed by combining word roots, prefixes, and suffixes. Knowing the common word parts makes it easier to understand complex terms. And you will see in tables 2 to 3 in your Archer and Nelson textbooks that there are common word parts that are used in manual therapies. So with respect to some of those word or word parts, we see that the word part, inter, the definition is among or between. Intra refers to within or inside. Ipsi refers to same. Ism is the word part that is used to describe a condition or a state. Iso means equal or like. Itis refers to inflammation. Logy or logy is the study or science of something. Lysis, which is dissolution or loosening or destruction. Macro refers to anything that is large. Mal usually refers to something that is bad. Micro, small. Mono, one. My or myo is usually something referring to the muscles or muscular system. Necro, corpse or dead. Neo, new. Nephra or nephro, the kidney. Neuro or neuro refers to anything with respect to the nerve or the nervous system. Oma refers to a tumor. Osis is also a condition or a disease. OS or OSTO is usually referring to something that has to do with the bone. So with respect to body regions, regional terminology describes areas and divisions of the body more precisely. And you will see in table 2.4 and figures 2.8 through to 210 that there are common terms used to refer to body regions. And examples of regional terms are sternal, carpal, scapula, lumbar, gluteal, femoral, canconeal, and plantar. And we will go into more detail in terms of what each of these different terms mean. But generally speaking, when we refer to sternal, we're usually talking about the sternum or something having to do with the rib cage. Carpal, we're talking about the carpal bones, which are in the wrist or the hand. Scapula, of course, is the shoulder. Lumbar is the lower back or the lumbar vertebra. Gluteal, the buttocks. Femoral has to do with either the thigh or anything having to do with the hip. Canconeal is the heel, and of course plantar is the foot. So we will get more and more exposure to what these different terms, what they mean, what they're referring to, and as I mentioned earlier, they will soon become second nature to you because you will be so well versed in the anatomical terms that you will be an expert in that regard. Now, the nice thing about table 2.4 is that it gives you the term, it tells you how to pronounce the word, it gives you a description of the region, and it also gives you the figure reference number. So, for example, abdominal, it shows you how to pronounce it, abdominal. It's referring to the belly region, and of course you can find that at figure 2.8. Acromial is the next, and we're referring to a point of the shoulder, and that's found on 2.9 and 210, figures 2.9 and 210. Antebrachial is referring to the forearm. Antecubital, and that is referring to the anterior elbow. Axillary is referred to as the armpit. Brachial is referring to the upper arm. Cancanial is referring to the heel. Carpal is referring to the wrist. And cephalic is referring to the head. Now in table 2.4, of course, this is an extensive list, and as I mentioned earlier, it gives you the pronunciation for how to pronounce these various words. As we see here, the first two, we have cervical, and it shows you how to pronounce it, cervical, and it's referring to the neck. And then coxal shows you how to pronounce it, coxal, and it's referring to the hip, normally the lateral pelvis. And so I really would like for you to take some time to just go through this list and practice pronouncing these words, because it gives you a very nice description here, and it really breaks it down so you can understand how to pronounce these terms. And after a while, it will become second nature to you. So don't stress about it right now. Right now is more time of getting familiar with what these different words are and how to pronounce them. And these, of course, are some more terms. We see the term vertebral, and it is referring to the backbone, and volar, which is referring to the posterior hand. Now in figure 2.8, which is illustrated here, this is an anterior view or frontal view, if you will, of the various body structures that we can see on the surface. So if we were to begin from the left-hand side, we can see the nasal and oral cavities. We see the pectoral region, the brachial region. We see the antecubital region, the umbilical region, the carpal region, the digital region, the inguinal and pubic regions, the patella, the crural, the tarsal, and the digital region. And then over to the right-hand side, we see the frontal and orbital cavities. We see the sternal, we see the axillary, the antebrachial, the palmar, the femoral, and we see the pedal. So these are all things that we can see from the frontal view, or the anterior view. Well, I guess I can still say frontal, but anterior view is probably the more correct term to use here. And here we have a posterior view. This is figure 2.10 in your Archer and Nelson textbook. Beginning from the left-hand side, the cranial or cephalic region, the acromial, and the gluteal. And then over to the right-hand side, we have the occipital, the cervical, the scapula, the vertebral or spinal, the alacronal, the lumbar, the sacral, the volar, the femoral, the popliteal, the sural, the calcaneal, and the plantar. Now let's consider the body cavities. There are 4 primary body cavities: ventral, which is also the interior, or dorsal, also referred to as the posterior. The ventral cavities are the thoracic cavity, which contains the lungs and the heart, and the abdominopelvic cavity, which contains the organs within the abdomen and the pelvis. The quadrant method and 9-region method used to subdivide abdominopelvic cavity is illustrated in figure 2.12. The dorsal cavities contain the cranial cavity, the brain, and the spinal cavity, which contains the spinal cord. So here we have illustrated the 2 ventral and dorsal cavities, and you will note that the abdominopelvic cavity has 2 distinct regions. And here in the thoracic cavity, the mediastinum is the central partition of the thoracic cavity that contains the heart. The lungs sit on either side of the mediastinum. And here we see illustrated the 4 abdominal quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. The umbilicus is the center point for dividing the cavity into 4 regions. The abdominal quadrants are further divided into abdominal regions. There are a total of 9 abdominal regions. We have the right hypochondriac, the epigastric, the left hypochondriac, we have the right lumbar, we have the umbilical, we have the left lumbar, we also have the right iliac, the hypogastric, and the left iliac. Pathology classifications and terminology. Pathology is the study of disease. Manual therapists should know commonly used classifications and terminology. And you will see in Table 2.5 that basic pathology terms are provided. Examples are acute, chronic, contraindication, diagnoses, lesion, prognosis, sign and symptoms. These are all terms that you will become very familiar with in the course of study of your chosen profession as a natural health practitioner. Now let's take a look at some basic pathology terms. Acute refers to something that is sudden or rapid onset. Chronic is gradual or long-term onset. Congenital is disease or a defect present from the time of birth. Contraindication is a sign or a symptom that could be made worse with a specific course of treatment, and it will most likely have a negative effect. Diagnosis is a determination of the nature of a disease, injury, or defect, naming of the disease, disorder, or dysfunction. Etiology is the cause or specific course of development for a disease. Idiopathic means that the disease is of unknown origin. Indication is a sign or a symptom that would improve with a specific course of treatment. Positive effect is more likely. Lesion is any pathogenic change in normal tissue structure, such as a tear, a tumor, a scar, or a wound. Prognosis is the expected progression or outcome of a disease or dysfunction. Sequela is the lasting result of a specific disease or dysfunction, such as a shortened leg after a healed fracture or low respiratory capacity after tuberculosis. A sign is an objective indicator of disease that is usually measurable, and a symptom is a subjective indicator of a disease that is not easily measured or quantified. Let's talk about how diseases are usually classified. Diseases are broadly classified by cause. Infectious causes, such as pathogens that come about as a result of bacteria, viruses, or fungi, and even parasite exposure. Or there may be what's referred to as environmental factors, such as cigarette smoke. And when we say cigarette smoke here, we don't mean the individual themselves may be smoking. The individual may be exposed to cigarette smoke from someone else. There are also hereditary causes of diseases such as hemophilia. And there are also what we refer to as nutrition and lifestyle causes of disease, such as dietary deficiencies or not consuming the right amount of food, or consuming too much of one type of food, things like that. And then, of course, lifestyle. This is where it comes down to maybe the individual. They may engage in cigarette smoking or indulging in alcohol or other harmful substances, things like that. Or maybe they have a sedentary lifestyle. So when we think about disease, we think about disease as being classified according to usually one of the four. So to summarize the main points of today's lecture, the anatomic position is the body standing with arms to the sides, feet shoulder width apart, and the face, feet, and palms facing forward. It is the basis for all anatomical terminology. All location, position, and movement terms are based on the assumption that the body is in this position. 3 anatomical planes divide the body into different portions. The sagittal plane divides the body into left and right sides. The frontal or coronal plane divides the body into front and back. And the transverse or horizontal plane divides the body into top and bottom sections. Prefixes, suffixes, and word roots form many anatomy and physiology terms. The body has 4 major cavities, 2 dorsal and 2 ventral. The dorsal cavities are the cranial cavity, which houses the brain, and the spinal cavity, which houses the spinal cord. The ventral cavities are the thoracic cavity, which houses the lungs and the heart, and the abdominal pelvic cavity. The locations of organs in the abdominal pelvic cavity are specified either by the quadrant method or by the 9-region method of dividing the cavity. Pathology is the study of disease. Diseases are categorized as being infectious, environmental, hereditary, or nutrition and lifestyle induced. Pathogens are the microscopic substances that cause disease. The most common types of pathogens are viruses, bacteria, fungi, parasites, chemicals, and particles. So for assignment number 2, I'd like for you to make a list of the orientation planes of the body, such as frontal, sagittal, etc., and provide definitions. You're also going to make a list of the directional terms, movement terms, such as flexion, extension, and provide definitions. And I'd also like for you to state what are the key pathological classifications that manual therapists need to know. So should have everything you need from this lecture as well as your textbook to complete this assignment. But as always, if you have any difficulty whatsoever, you can shoot me an email or send me a text message to my cell phone number 703-7327. And as always, my office hours are from 4 to 6 p.m. on Thursdays. So if you have any difficulty whatsoever, please do not hesitate to reach out to me. Other than that, I look forward to your participation in this week's forum, which will be posted on the website. And if it's not there, I would have sent you an email to let you know where we're going to be posting for this week. But other than that, do have a great week.